So here we are, Jim. I'm really pleased to host you for this interview. And it's been almost 7 years since the Leon Eisenberg Award in 2011 in Boston at Children's Hospital. And we're here at Carola Eisenberg's home in Cambridge, Massachusetts. And we are also here to continue to honor Leon as part of this interview series, as well as the American Academy of Child Psychiatry that has sponsored some of these history interviews. So I'm really delighted to host you and want to introduce you as a professor of psychiatry and behavioral sciences at the moment in pediatrics, public health, and history of medicine at Johns Hopkins University Medical School, and also the founding director of Developmental Neuropsychiatry Clinic and the services that emerge as having also led the division of child psychiatry there at some point. So I'd like to begin, Jim, from the very beginning in terms of, tell us a little bit about, you were telling me that you were born during the time of the third inauguration of President Roosevelt. So maybe you can tell us a little bit about, you were born in Birmingham, Alabama, I know. So maybe tell us a little bit about the circumstances in which you were born and your family background.
Well, I was, my grandmother always got had a great interest in the fact that I was born on the day that Franklin Roosevelt was elected president for the third time. This was in 1940. And my father had gone to a VMI and was a captain and was assigned overseas shortly after my birth. So I grew up with my grandparents for the most part until the end of the war. And then after the war, we traveled a lot because there were difficulties for people who were returning from the military. Their jobs were supposed to be maintained, but they weren't necessarily. So that led to me spending most of my elementary school years in Utah, in Provo, Utah, and as a non-Mormon, which was of some interest because we learned about Utah history rather than the U.S. history for the most part. And then when I was a teenager, we moved to Maryland, to Montgomery County, and I had my education in Montgomery County, Maryland, and graduated from high school. I was president of a student body, and then I went on to college, and then eventually, after college, to medical school. In medical school, I became interested in development.
Okay, let me just stop you there because we want to take it step by step. So when you were living in Maryland, so you went to University of Maryland and College Park, right, Maryland. And what did you study as an undergraduate?
Well, I studied psychology and zoology, but I also took a number of elective courses in the philosophy of science and in literature. In fact, a class I took on existentialism when I was a college student probably had a great deal of influence on me when I eventually decided to go into psychiatry.
Right. So I'm very interested in the life of scientists, and so what drove you to zoology and psychology? I mean, what was your burning interest?
Well, what happened?
Or was it generalized sort of?
Yeah, when I was a college student, I worked part-time at the Bureau of Mines in a chemistry laboratory. And at the time I was a psychology, I was taking courses in psychology. And I decided that I didn't want to be a chemist, but I wanted to be a psychologist. And I remember one day actually cleaning glassware in the lab, thinking that what could be more interesting than understanding the human mind? And from that point on, I decided that I would take additional courses in biology and majored in zoology, but had a psychology and essentially developmental biology interest.
And you were also mentioning philosophy, right? You were also interested in philosophy?
Exactly.
Yeah.
Philosophy of literature and science.
Yeah, right. So you were sort of very broad. So then, in 1962, after you graduated University of Maryland cum laude, you went to the George Washington University School of Medicine in Washington, D.C. So tell us about, at that time, this is the 60s, right, in Washington, D.C.?
Well, it was actually medical school. I enjoyed medical school so much that I decided that if I never practiced medicine, just the experience of medical school would have been enough. Because being at GW at that time, we had rotations throughout the Washington area. And some of the ones that interested me were twofold. One was I worked with a psychiatrist on a research grant to interview chronically ill patients. And that led to my summer funding for research on development.
This is Dr. Meyersberg?
Dr. Herman Meyersberg.
Yeah. Mm-hmm.
And then as a medical student, I also, for 2 years, lived at the D.C. jail, and I worked as an extern there for my room and board. And so living at the D.C. jail, I learned a great deal about drug addiction and about forensic issues. In fact, Joe Valachi, who was famous for the Valachi rights appeal, was one of our prisoners. So my time in medical school at the D.C. jail, working in the evenings, and my electives and my rotations at St. Elizabeth's Hospital, it consolidated my interest in psychiatry. And in my last year, I had a scholarship, the Pollard Award, for a student who was interested in psychiatry.
And this is very interesting because when we were speaking with Dr. Carola Eisenberg before, during one of our interviews, she mentioned to me about the visit with your father to a state psychiatric hospital and seeing and how influential that was. And in fact, you worked as a social worker or learning how to be a social worker in Argentina. So it's very interesting that you talk about this prison experience and also I'm sure the conditions of St. Elizabeth's Hospital was kind of at that time might have been somewhat reminiscent of what you faced.
Yeah.
Well, St. Elizabeth's though we had some very qualified people.
Mm-hmm.
Sammy Leon Yokelson was the chair of the department, and his brother was a forensic psychiatrist. I mean, this was, if we fast forward to the future, this is part of my interest in forensic psychiatry now.
And at that time, Professor or Dr. Goodmacher in forensic psychiatry at Johns Hopkins, right? Have you met?
No, I didn't meet Manfred Goodmacher.
Because you came much later.
But much later, but everyone knew of him because he was the leader in the field of forensic psychiatry.
And this was Carola's first husband, just for the record. So the other thing that interested me, actually, Jim, was in 1965, you do some sort of a global mental health internship or some experience and I read that you were in the Kuala Lumpur Hospital in Malaysia. And
well, as a medical student, living in Washington, and remember, this was at the time that John F. Kennedy was elected president. And so, we would watch Kennedy when he'd come back. We'd walk out of our classes and there'd be a parade and so on. So we were very interested in the enthusiasm for helping people around the world that came from Kennedy's presidency. And so I got very interested in Care Medico, Tom Dooley, who was working in South America.
Right.
And Tom Dooley had founded a hospital in Malaysia. And so at that time, the AAMC, the American Association of American Medical Colleges, and SmithKline and French offered overseas fellowships. So I had an overseas fellowship with the Care Medico team in Kuala Lumpur, Malaysia, for over 2 months, where I worked in the regular hospital. And when the physician of record became ill, for 2 weeks, I was the chief of service, basically, until he came back with Malay doctors who would help me. But the most interesting part of that time was I spent several weeks at the Aboriginal hospital and with the Sinoi people. And I learned about these people who believed that dreams were basically created reality. So there was a lot of interest in the cross-cultural aspects of psychiatry that were initiated during my time in Malaysia.
Right. And then, so when you finished, you interned in the Children's Hospital, Los Angeles, right. And after the medical school at George Washington. So that was a pediatric internship, right? Right. Were you interested in pursuing pediatrics at that time, or?
No, I was interested in pediatrics. And I had been mostly impressed with working at Children's Hospital in Washington. Mm-hmm. Was a very well-known child psychiatrist at Children's Hospital, and Richmond Payne was the neurologist. Mm-hmm. So I decided to apply for a pediatric internship. And Los Angeles had a great deal of appeal because there was a large hospital at Children's. Mm-hmm. So I went there for that year, mm-hmm. And then that led to my time in the Peace Corps. Right,
and then in the year subsequently, you entered the Peace Corps in Thailand. Tell us all about that, because that's a 3-year period. You were advisor to the Peace Corps on public health programs, and also you worked in the Thailand Maternal and Child Health Center as a volunteer physician, right? And I understand you speak Thai.
Well, I do speak Thai. Quickly, what happened was that the year was, I had applied to the Public Health Service and I hadn't heard anything. So I volunteered to go to Vietnam as a pediatrician. And I wrote to the State Department. The State Department invited me to come to Washington for an interview. I arrived in Washington. The person I was to meet with happened to be out of town that day. So I'd flown all the way across the country. And they told me that, well, we'd like to find a position, but we're not sure. So I called the Peace Corps, Public Health Service rather, and to my surprise, that very day they had been trying to reach me in Los Angeles to be interviewed as a Peace Corps physician. Mm-hmm. So I stayed on. I was interviewed. The day ended with Jack Vaughan, and I was offered the position of Peace Corps physician in Thailand. I wanted to go back to Southeast Asia anyway because of my time in Malaysia. But that was very fortuitous, right, because when I returned to Los Angeles, I found my draft notice waiting. And had I not been accepted by the Peace Corps, I would have been drafted as a private. So that was great luck. So then the 3 years in Thailand, the aspect that had to do most with psychiatry was I was the Peace Corps staff physician. Mm-hmm. So I was the doctor for the Peace Corps volunteers. Many of the Peace Corps volunteers became Buddhist monks, which was a Thai tradition. And I would pay for their robes and their bowl and be involved in the ceremony. And that led me to become sufficiently interested. By the time I left, I was coordinating the Buddhist orientation for Peace Corps volunteers, for CUSO volunteers, and for the British.
So what kind of patients were you seeing as a volunteer in the hospital?
Well, the volunteers, for the most part, the volunteers had medical illnesses, tropical diseases.
Adults and
they were all adults.
Yeah.
But what I was interested in was the benefits that came from them doing these Buddhist practices. Mm-hmm. So I became interested enough that I spent 3 months myself as a lay practitioner in a Buddhist monastery doing mindfulness meditation practice. And it was there that I confirmed that I would complete my psychiatry residency when I came back to the States.
Very interesting. So you missed Vietnam, and this is actually around.
Well, no, I didn't miss Vietnam.
Yeah.
I was right in the middle of it.
You're in the middle of it,
I
but
was
you
in
kind of missed
I was
the,
in northeast Thailand,
you're in the-
and there were people who were communists who were
the
infiltrating. The Peace Corps program
Yeah.
was a pacification program, really, to keep the Thais on our side.
Yeah.
At that time, I was in Thailand during Tet, and so on.
Right, and there's also this coincides with the Nixon's presidency, and then I think the Nixon's visit to China, the ping pong diplomacy became
Right.
it was in 1971.
Right.
So this was slightly before then. So there was so how did they like Americans in Thailand at that time? How were you treated in the Peace Corps?
Oh, well, we were treated very well.
Very well.
I mean, the Peace Corps started in Thailand in 1963, and this was about the 5th year of the Peace Corps.
Right.
But we had Peace Corps volunteers that were basically assigned to different programs in malaria and community health and so on. And the Peace Corps volunteers were assigned to try to give prestige to a local person who was doing a good job, basically. So we were trying, the Peace Corps was really organized to try to facilitate community development and malaria eradication and so on. One of the Peace Corps volunteers that worked closely with me, Jack Cornfield, became the leader of the mindfulness meditation movement here, actually.
So have you gone back to Thailand subsequently? I know you
sure.
go to Burma and a lot now, but every year. But have
Well,
you come back
my wife and I went to Thailand for our honeymoon. We went to visit the monastery where I stayed and got the blessing of my former Burmese teacher.
Right.
And he actually saw my beard, which I didn't have when I was in the monastery, and asked her if it tickled if I gave her a kiss.
Okay.
So he was a fairly jolly old guy. And then we've been back several times, including a trip to Thailand and Burma.
Excellent. So, all right. So then you come back to the U.S. and you come to the town of Rochester, New York, as a associate resident in pediatrics at the Strong Memorial Hospital. That's a hospital that I think has got some influences in psychobiology, if I remember, because Engel was there, right? Who's a medical student at Johns Hopkins and is the biopsychosocial. So tell me about that, starting your pediatrics.
Well, what happened was that I needed to complete my pediatric residency before I did psychiatry. So I went to Rochester because of Robert Haggerty and the community psychiatry program there. But while I was there, Romano was the chair of psychiatry. He was a very well-known psychiatrist. I worked with the behavioral pediatric and psychiatry program there as part of my rotation. But the nice part about it was that as a senior resident, I did the all specialty rotations. There was a confusion about the time frame, so I ended up doing their second year residency first, which was all subspecialty. And George Engel regularly came by to interview patients. So, of course, I was very interested in George Engel because he was both a physician and a psychiatrist.
Correct. Well, that's a department that has also had a very strong psychiatry. And I know Eric Kane actually does that work in suicide in China, has been there as a chair for many years. And so then 1 year later, you go to your now current home, that has been your home for many, many years now, Johns Hopkins Medical Institutions in Baltimore, and you become a senior assistant resident in pediatrics. This is the Harriet Lane program, right? So
yeah, I had been recruited to Hopkins the year before by Bob Cook, but I had already accepted the position at Rochester, so I didn't go the previous year.
Right.
But because I had done the subspecialty rotations at Rochester, and subspecialties were what the first year residents did at Hopkins, I came as a senior resident to Hopkins, met my wife, and was recruited by Bob Cook, which was a wonderful experience because Bob Cook introduced me to the ethical issues in child psychiatry and in pediatrics, and particularly because that was the time that we had admitted a child with Down syndrome and the parents refused surgery for that child.
Tell us about how you got to know Bob Cook and how he became interested in you. So how did that work out? How did you get to know him before you were recruited, you said, there? So how did that happen?
Well, I applied, basically.
Yeah.
And I had been accepted the year before, and they had an opening. And remarkable.
Did you get interviewed by him earlier, or?
Well, I'd been interviewed the year before, and
Oh,
I was
I see.
interviewed again.
Yeah.
But the thing that's remarkable about it is the year before I had turned down the position and went to Rochester.
Uh-huh.
And the person who was offered the position I had turned down was Kathy DeAngelis.
Oh, now it comes out.
So we found out years later that by circumstance that Kathy and I would never have met, probably, if I hadn't turned down the position at Hopkins the year before. And so we met there. But to get back to this,
Thank you for explaining that. That's very important.
Right.
Yes.
But the thing that's really most important is that Bob Cook and Norman Faust and the Kennedys were working together at that time to develop a focus on developmental disabilities in people with these problems. Bob Cook had 2 children with Crete-Shaw syndrome, and Bob was very sensitive to the mental retardation needs. Lee O'Connor had been the director of child psychiatry, and Lee O'Connor always emphasized both mental retardation and child psychiatry. He wrote an annual report in the American Academy, the American Journal of Psychiatry, on progress in child psychiatry and mental retardation. So it was part and parcel of the program. And when I first went to Hopkins, I came a month early, and I spent a month at the Kennedy Institute at that time. And then with Bob, the focus on this sad story of a Downs patient who died because the family refused surgery led to a film called Who Shall Live? And this set off the entire ethics movement as it related to developmental disabilities. And basically I was part of that. And that was what, that and the Kennedy Institute stimulated my interest in developmental disabilities.
Well, I think if I can say that at the Georgetown University, Beecham had written an essay, which I always distribute to my fellows. It said, "Who should live when not all can live?" Which is sort of the this idea of ethical decision making. So this is so you're then drawn into psychiatry soon thereafter because your interest and roots of your interest in psychiatry draws you to do a child psychiatry fellowship at Hopkins, and this is before Paul McHugh, right? And so who was the people?
Well, the person who recruited me into psychiatry at Hopkins. Well, I was in pediatrics,
right?
And I initially did a year with Alejandro Rodriguez,
who was the chief of child psychiatry.
Chief of child psychiatry, and it was a child with autism that really stimulated my interest in completing my training. And then Joel Elkes recruited me into psychiatry. So Joel Elkes was my chair of psychiatry at Johns Hopkins. Right. And Joel Elkes had a very broad interest. He worked very closely with Leon Eisenberg.
Right.
In fact, Leon was in pediatrics because from Connor onward, the chair of child psychiatry reported to the chair of pediatrics, but Leon was half supported by psychiatry and half supported by pediatrics. In fact, when I became the division director several years later, Leon's office, I was very proud to say, became my office.
Oh, good. Yeah. So we're going to get to that.
Right.
We don't want to jump the gun.
Right.
But so tell us about what I understand you moved from pediatrics. I mean, you were very well supported in pediatrics. You had done an internship in pediatrics. Why didn't you stay in pediatrics? What was, I mean, you were also interested in these very serious developmental disorders already. There is the university-affiliated programs at Johns Hopkins. The Krieger is there. There's these facilities. So why did you shift to child psychiatry?
Well, largely because from my medical student years with the scholarship I had, with my summers working with psychiatrists, and my time in Thailand trying to understand the impact of mindfulness meditation on Peace Corps volunteers, I was always interested in psychiatry, and I was always interested in development. But it was largely because of the patients that I saw, and the fact that in pediatrics I wouldn't have enough time to engage in the depth that I wished to, that I decided to take a fellowship with Alejandro, and then thanks to Joel, who was really very interested. I had many meetings with Joel Elkes.
Yeah.
I went on into psychiatry.
Well, thank you very much for explaining that. That's very important for us to understand. So you also, in this institution that previously had two amazing people in child psychiatry, and I'm obviously Leo Kanner and also Leon Eisenberg, who succeeded him. But by 1967, Leon had moved to Mass General Hospital as chair of psychiatry. So you didn't really overlap with Leon, but Leo Kanner was still alive. And
no, I overlapped with Leo Kanner.
Leo Kanner,
and as a medical student, as a resident, I knew him.
Yeah.
In fact, when Leo Kanner reported on the follow-up of the first 11 patients 28 years later, he came to our clinic and he read his paper to us for feedback before it was published. And so we had a chance to discuss the follow-up study with him. And I'll never forget this, because I asked him a question afterwards about how do you approach the autistic child. And he said, young doctor, the autistic child approaches you. You need to watch to see when the child looks out of the corner of their eye, when they notice your presence, because only at that time can you approach them. And I never forgot that.
So we have two people in the room here with Carola and both
Carola knew very well as a resident.
Leo Kanner. We can tell stories about Leo Kanner and the circles of the cigar smoke that he used to have. So you had I know that he really influenced you. He was very influential on you. I remember once you told me, actually, or told others in the group, that he came to meet you because he wanted to meet the person who was going to lead the developmental neuropsychiatry in Johns Hopkins. He wanted to congratulate you.
There was a reception
Yeah.
when I was made the division director in pediatrics. And I was, I have to say it was the proudest day of my life.
Right.
So Leo Kanner came up and said, I'd like to shake the hand of my successor.
Right.
And so we met, and I talked to him. I saw him interview children with autism. And when DSM-3 came out, I went to his apartment and gave him a copy, and we talked about it. And that was really pivotal. In fact, I spoke about this when I gave the memorial to him the year he died, because when I gave him DSM-3, his response, well, first he looked at DSM-3, and he looked in the index, because he wanted to make sure that Leon was referenced, and Leon was referenced. And then he went on to give me a paper he'd written called Iatrogeny, physician-created disease. And another paper he'd written that the children haven't read those books. So I thought he was going to be interested in the criteria in DSM-3. He was more interested in children being treated as individuals than he was in the diagnostic criteria. And he said, the children didn't read these books. And we know that nature is sometimes produces disorders that we can define, and we need to define them. But no matter how well we define them, we still need to treat children as individuals. And that's a day I will never forget. And then after I gave him DSM-3, and he looked at it, and he said, before you go, I'd like to give you a book. And he gave me this big blue book. It was engrossed on the cover, What Every Man Knows About Women. So I opened the book, and it's a book of blank pages.
He had a great sense of humor.
And the other good news is this, is that Alejandro Rodriguez, when Kathy came back to Baltimore before we were married, had arranged for her to have an apartment in Highfield House that was 3 doors down the hall from Leo Kanner. And so she used to ride up and down the elevator with him. When we were married, when I proposed to her in 1978, I was 3 doors down from Connor when I made the wedding proposal.
Right.
So in a sense, Connor and Kathy and I, although we never actually spent time together, were very pertinent.
Where were you when you learned Connor died? When he died, what was your reaction?
Well, what had happened was this, is I last met with him in 1980 when he was living in Highfield House, but his wife, June, had developed Alzheimer's disease, and they moved to this Springfield retirement center. So I didn't see him after that, and then he died in 1982 in April. So when he died, it was announced, and I went to his funeral. In fact, I still have the marker that you put in your car for your position as you go. And at the funeral, I'll never forget this, because the rabbi who spoke talked about Connor viewing children as discoverers, and that Connor believed that each child needed the opportunity to discover the world in their own way. It was beautifully presented. And then shortly after that, I was invited to give the memorial to Leo Kanner in October 1982 at the Academy of Child Psychiatry meeting. And so at the opening session, I gave the memorial that I've shown you to Leo Kanner. So he was a major influence, as of course was Leon, because they were both advocates in the purest way. And that advocacy is the thing that I think is such a powerful legacy that they've both given us.
And Carola as well here. This is a legacy that is amazing and hopefully lives on. But thank you very much for the wonderful memoriams that you wrote, both for Leon as well as for Leo Kanner, and also your contributions to Leo Kanner's legacy that took some hits this year, or last year, with the publication of a number of books. But you have been there to put the story right.
Let me just say a quick word about that. These 2 books, Silverman's Neurotribes and the other book, Autism in a Different Key, misrepresented Connor, because Connor was prescient in recognizing autistic traits in parents, what we later call the autism phenotype. So he didn't blame the parents, he described them. And later we know through research that Joe Piven and others have done that there is a genetic component. And he was, I think, the first to recognize that.
I want to continue with your progression, going back to your following your starting your fellowship in child psychiatry. Then you did a fellowship at the Krieger, I guess, the Kennedy Institute, and that's where neurodevelopmental pediatrics and child psychiatry began for you in that fellowship, which is really, you're immersed in that work. This is in 1973-74. And then you again do the reverse, and you go into the Phipps Clinic to do adult psychiatry, because you have to do your adult psychiatry backwards, right? So
right. But I consider it to be...
Put the story.
Well, as far as I'm concerned, it's the only way to do it.
Yes.
In fact, I'm campaigning that we do away with the lockstep training from general psychiatry to child psychiatry, and everyone do a child psychiatry introduction for the first 2 years, and then they do their adult psychiatry, because it's we'll never recruit people that way. But the way that this happened is that from pediatrics, I did a year of child psychiatry, and was very involved in the general program with Jerome Frank and with Joel Elkes and others. The second year, I did a psychiatry fellowship at the Kennedy Krieger Institute in neurodevelopmental pediatrics as a psychiatrist. So I was there as a psychiatrist. And so every week I organized a psychiatric conference and invited various speakers. And it was from there that I developed the idea of a developmental neuropsychiatry program. Because I didn't start a developmental neuropsychiatry clinic. I started a developmental neuropsychiatry program, and after I finished my training, I was out of residency. I was made the director of psychiatry at the Kennedy Institute, and I set up 5 specialty clinics, and those specialty clinics became the genesis of my textbook on developmental neuropsychiatry,
which you published in 1996. 97. But we'll come back to that. And so the directorship of the Developmental Neuropsychiatry Clinic gave you a lot of exposure to amazing range of developmental disorders. Intellectual developmental
let me just
autism,
correct
right?
you. It wasn't the Developmental Neuropsychiatry Clinic. It was the Developmental Neuropsychiatry Program. And I recruited 4 people.
And then you have these different clinics.
4 people,
inside.
Alan Reese, Joan Gehring, and others, to
corrected.
set up subspecialty clinics within developmental neuropsychiatry.
Correct. All right. So, and then 2 years later, then you became the director of Division Child Psychiatry.
Right. In pediatrics.
Yes, in pediatrics. Did child psychiatry is in pediatrics, or? Child
psychiatry started in pediatrics. It was designated by Edwards Park as a subspecialty of pediatrics, just like cardiology was with Helen Taussig, that endocrinology was with Lawson Wilkins. If you went to the pediatric emergency room, there was a big chart on the wall with photographs of subspecialties started by Edwards Park, and child psychiatry was one of those subspecialties.
So if you were not trained in pediatrics, because you were already trained in pediatrics, would you be the division chief? Because you were now identified as a pediatrician, right, also? I'm just
well, you didn't have to be a pediatrician
to be a division chief.
To be the division chief, because Leon Eisenberg was not a pediatrician, and neither was Leo Connor.
So Leon also was in the division of pediatrics?
Yes.
Half and half, you mentioned.
No,
half.
but he reported to Bob Cook.
I see. Well, this is actually, I did not know this. This is an interesting information. Because it's very unusual, because you talk about Helen Taussig.
Well, it's called unusual because you're looking at it from the current perspective.
Yeah.
At the time, it was usual. Child psychiatry didn't become a specialty of psychiatry until 1957. Right. You know, for 27 years before that, Leo Connor had been training people as a pediatrician, reporting to Edwards Park and later to Bob Cook. But the issue was was that Paul McHugh wanted child psychiatry to be part of the psychiatry department.
And Paul McHugh comes to the scene in 1970.
Paul McHugh came in 1975.
75.
In the last few months of my residency in psychiatry. And so when I became, both Paul McHugh and John Littlefield agreed that I would direct the child psychiatry division in pediatrics, but Paul wanted the division to be in psychiatry. John Littlefield, who was the chair of pediatrics at the time, did not want to give up child psychiatry. And so there was a joint agreement between the president of the hospital, the dean of the medical school, the two department chairs, but child psychiatry would be a shared specialty with joint appointments in both departments.
And what has happened subsequently in the tenure of Paul McHugh? Has it shifted towards
So
psychiatry?
what happened then, because of a joint agreement, we had a fiscally autonomous division, and that for fiscal reasons, Joe Coyle reported, who followed me, Joe Coyle reported to the dean of the medical school and not to Paul McHugh. But academically, we were in the psychiatry department. And then gradually over the last years after Joe left, child psychiatry is now part of a psychiatry department and reports to the psychiatry chair. But this was a gradual transition that took many years.
So you don't need to have gone to Paul MacLean Evolutionary Biology Lab to learn about the evolution of child psychiatry at Johns Hopkins. It's a very interesting evolution, which I think many people listening to this interview might not actually know, because how this child psychiatry that was established as the first academic department of child psychiatry in the United States was actually part of a division of pediatrics.
Not the division, the
thank you very
department
much
of
for
pediatrics.
explaining that to me.
Department of Pediatrics.
Interesting. I'm very interested, before we get to Joe Coyle, because we also interviewed him in this part of the series, when Paul McHugh came, and I'm going to give you a little bit of a background, he trained he was at Harvard College and Harvard Medical School, and he met Dr. Thorne at the Brigham Women's Hospital, who encouraged him not to do psychoanalytic training, but rather train in psychiatry, but first get a training in neurology. So he went to train in neurology at Mass General Hospital in the Department of Neurology under tutelage of Ray Adams.
Right.
So, but he then went to the Institute of Psychiatry to train with Sir Aubrey Lewis, who, by the way, trained with Adolf Meyer at Johns Hopkins.
Right.
And he was very much interested in the idea of psychobiology, and my sort of a whole linking all this is to do with, and then we mentioned Engel and Leon Eisenberg and Adolf Meyer and Leo Kanner, is that many of these people were all psychobiologists. They were sort of under the influence of Adolf Meyer one way or another.
Meyer,
yeah. And so Paul McHugh comes with this stellar training in sort of psychobiology / neurology, but intellectual rigor as well, to Johns Hopkins as the chair, after having moved around actually in the United States, being at different places before he comes to Johns Hopkins. So he's very much almost like groomed into this position at Johns Hopkins. Yet you, on the other hand, you're like the Peace Corps and all this sort of pediatrics, and you find your own sort of niche, as it were. It's a very different background, coming from Alabama, Utah, Maryland, and then going into medical school. You don't have Dr. Thorne or Ray Adams, so you have a little bit of a very different background in this. So I've never met Paul McHugh, but I was just curious about how the department under him evolved, because you were there, and he was very influential at Johns Hopkins. So,
well, let me just say one thing first. When I was a medical student, I was influenced by Herman Myersberg.
Right, you mentioned that.
And by Reginald Lurie, who was the director of child psychiatry at Children's Hospital in Washington, and the other experiences I've told you about. Then my views of psychiatry developed from working with Joel Elkes, Jerome Frank, Horsley Gant, and the people in the psychiatry department before Paul McHugh came. Paul McHugh spent 1 year in psychiatry with Aubrey Lewis.
Right.
And he did a neurology residency. His training was not focused as a psychiatry resident in the same way that ours was. and he developed his own perspectives of psychiatry.
Right, which is the title of his book also.
Which he's promulgated and very successfully over the years. But when he came as the chair, my focus was much more on psychiatric treatment and neurodevelopment. And so I recruited all the family therapists who had worked in the general department to work in child psychiatry. And so we developed really two parallel types of programs, during those years, because my focus was on a developmental perspective, as Leon had brilliantly written in his paper in the British Journal of Psychiatry. Development is a unifying principle in psychiatry.
And you're also in the pediatrics, is still in the pediatrics.
We were in the pediatrics department in the pediatric hospital.
And so during this time, your directorship, you also formed affiliation with the Center for Brain Evolution with Paul MacLean, right?
Well, here's what happened.
Yeah, tell us about that.
When I began my residency program, Jerome Frank had been my supervisor, and I worked very closely with Jerome Frank in terms of psychotherapy and his views of psychotherapy, persuasion, and healing. He introduced me to Paul MacLean because he knew of my interest in the neurobiology, the psychobiology, that I had learned from Eugene Meyer and other people there in regard to Adolf Meyer. And so I then negotiated I would have 1 day a week to work with Paul MacLean as part of my contract when I joined the faculty. And for the next 8 years, it was more often 3 days a month rather than 4 days. I went to Poolesville to the Animal Center and worked with Paul to look at evolutionary biology as it relates to brain development in psychiatry.
Right. So that's a very important part of your...
and Paul MacLean was a major influence.
Yeah.
Don't forget, Paul MacLean is the person that defined the limbic system.
Limbic system, of course.
Yeah.
So, okay, so you really touched upon by many influential people during this time. So then tell us about, you said that you recruited Joe Coyle as your director of psychopharmacology in your division, and then what happened?
Well, it was interesting because when I was a resident at Phipps, during my final 2 years, Joe Coyle, Ray DiPaolo, Elliot Richardson, and I were all co-residents. Joel Elkes had started the MD PhD program in the psychiatry department, and Hank Herrera was there. He had a PhD in sociology. So we had a very good group of residents. And since I worked so closely with Joe as a resident, when I became the division director, I recruited Joe as the chief psychopharmacologist for child psychiatry.
So Joe had attended Johns Hopkins Medical School and also had done work with Sal Snyder and had been sort of very interested in the neurobiology, and so you had then recruited him. So he was a resident in child psychiatry under your
Well, quickly, Joe
division.
Coyle, after he did a pediatric residency with Bob Cook.
Yeah.
Then he worked with Julius Axelrod, who was a Nobel laureate, in developmental neurochemistry. And Joe came back, and when he joined the faculty, he was an assistant professor as well as a resident. And he had his own laboratory throughout the time. And Saul Snyder had influenced him as a medical student. But, I worked very closely with Joe, and because Joe had this neurobiology lab, and he and Saul Snyder were being recruited to go elsewhere, it became an issue because child psychiatry was going to go into this new arrangement as a joint arrangement venture with psychiatry. And so we needed to recruit a new director. And so Joe became the director, but because Joe wasn't a child psychiatrist, I continued as the program director, as well as the director of psychiatry at the Kennedy Institute.
But and in terms of your contributions, I am very much aware that during your tenure as the director of child psychiatry at Johns Hopkins, you had 6 of 13 residents who began training during the time and entered full-time academic positions in Brown, Duke, New York Medical College, UCSD, and Johns Hopkins, George Washington. And then 2 became direct division chiefs. And some of these individuals have had stellar careers in.
Yeah, Pramjit Joshi also became the
Dr. Joshi
president
became
of the
the president of
Academy,
the American
and
Academy.
she also
Child
became
psychiatry.
as I was, the president of the Society of Professors of Child Psychiatry.
Right.
Wen-Jen
Which you
Kim,
also- yeah.
Wen-Jen Kim is still the division director
Right.
at Rutgers.
Yeah.
There were at least 10 people that I recruited who became division directors, either as the division director or the program director.
Yeah, so, well, I want to shift gears now and just to tell us a little bit about some of your scientific work, because you've done a lot of work on behavioral phenotypes. And so tell us about how you fit that in your scientific research, and you have gotten R01 grants to do that and study. So tell us, how did that fit in with all the other academic training, teaching, and using it through time with Paul MacLean's lab and so on? How did this all come together?
Okay, well, what I learned from Paul MacLean was the importance of species-typical behavior. Because at Poolsville, at the NIH Animal Center, we were looking at many different species of animals. These weren't just mice and rodents. There were Siberian hamsters, there were marmosets, there were rhesus monkeys, and so on. And so, in turkeys, and Paul was showing us how each species has its own typical type of behavior. And as I was working at the Kennedy Institute, I was seeing genetic syndromes and seeing in a similar way that there were behavioral phenotypes that were species, in a sense, typical to that particular genetic disorder. And I was particularly interested, because of my interest in psychiatry, in Lesch-Nyhan syndrome. And Mike Cataldo, who was one of the psychologists I worked with, had been encouraged by Hugo Moser to develop behavioral programs for children with self-injurious behavior. So I actually had the good luck of being involved in the beginning of PET scanning at Hopkins, not to look at metabolism, but to look at neurotransmitters.
Right.
So my first two grants were to look at self-injury in Lesch-Nyhan syndrome, and to look at emotional and development in autism.
Right.
And so both of these were PET
And
scanning
you were
programs.
one of the first to demonstrate the dopamine deficit in Lesch-Nyhan syndrome in vivo, right?
Right.
Yeah.
Yeah, and our PET work, we went through a number of years. Initially, we had to get compassionate approval to do our PET studies from children. But then when we moved on to more sophisticated ligands, we were able to study adults. And I had to find a Lesch-Nyhan patient who could give his own consent to do that. And I eventually found one patient, and that patient told it all, because he had an 80% reduction in dopamine. So what we showed was that the dopamine reduction in the brain, which is not expected, this is a disorder of purine metabolism that causes hyperuricemia. But the fact is that the dopamine reduction is correlated with the movement disorder, and also to some extent with the self-injury. So we essentially used a known genetic disorder to try to understand the underlying pathway from gene to behavior in a syndrome. And I also was involved with Hugo Moser when Andreas Rett brought the first 3 Rett patients and published the first PET paper looking at Rett syndrome. So, but all this interest, kind of tied in with Paul MacLean, because we were looking at how the brain evolves in a way, either in a genetic syndrome or in a different species, to have a developmental trajectory.
Right, and in fact, what you do is like one of the things that you've done in the 4 editions of Nelson's textbook of pediatrics is to write the chapter on purine and pyrimidine metabolism. Right, you're probably the only psychiatrist able to do that. It reminds me a little bit about Alan Crocker, one of the founders of developmental behavior pediatrics at Boston Children's Hospital, and his work on mucopolysaccharidosis, and Dana Farber and Sidney Farber, and
But I have to
Yeah.
say one word about
Yeah.
Alan Crocker.
Yeah, please.
Because Alan Crocker
All the
did
way.
something once I'll never forget.
Yeah.
Alan Crocker, I was very interested in Down syndrome and depression
Yeah.
because I was seeing kids who were hyperactive and had depression with Down syndrome who were being referred to me query Alzheimer's disease because of all this overemphasis of Alzheimer's disease and Down syndrome. So so I'd written a paper about treating depression masquerading as Alzheimer's disease,
yeah.
basically.
Which is very commonly seen.
And so Alan invited me to come to the Downs meeting in Boston. So I came to the Downs meeting. So Alan stands up in front of the assembled audience, and he takes off his shirt. And I thought, my God, what is that? He takes off his coat and his shirt. And I thought, what's Alan Crocker doing? And he turns back to the audience, and he's wearing a T-shirt that says, "Up with Downs." And I'll never forget that, because I just gave a talk about using marmosets as models for neurogenetic syndromes, and I used the Rett syndrome T-shirt. So in the middle of my lecture, I turned away from the group, talked about Rett syndrome, and said, this is why it's important. And then I turned back, and I had my Rett syndrome T-shirt, and it said, emblazoned on it, "Believe in better days."
Right.
And I said, this is what we need to do.
Wow.
We need to believe in better days, and we can find better models to help kids with these problems.
Well, of course, these are very, very innovative.
But Alan Crocker was a great influence.
Yeah. So, and tell me about how I'm going to get to Leon Eisenberg. Before I get to him, since we're talking about Alan Crocker, Ludwig Szymanski at Children's Hospital. He's the founder of the developmental psychiatry program there. So, my predecessor. And so tell me a little bit about how you got to know Ludwig and how did that relationship evolve. I know that he cover to cover read your book in 1996 and made some suggestions, and you thank him in the book together with some other people.
Well, what happened was this. We have to go back to Bob Cook for a minute.
Okay, go ahead.
Bob Cook worked with the Kennedy family. We know that Rosemary was mildly intellectually disabled and was treated with prefrontal lobotomy, which had a great influence on her sister Eunice. So Bob Cook, with his two children, with Creta Shaw, and Eunice got together and convinced John Kennedy that something had to be done. And so Bob Cook and Eunice were playing tennis one day at their house in her house in Maryland, in Potomac, and a call comes asking for Cook to make a comment from someone from Congress. So Cook dictates something saying, we need to have centers for research in mental retardation in this country because these children are in great need. And he goes back and finishes his tennis game. Mm-hmm. 3 days later, he learns that what he had dictated had been transcribed and put into legislation that was eventually passed.
This is 1966?
Yeah.
Yeah. Or 65?
No, it was earlier than that. Anyway.
But this was during the Kennedy presidency or afterward? During Johnson
No, this was, I don't know whether Jack, it was during the Kennedy presidency.
Okay,
no,
so
it was definitely during the
presidency.
It was during the presidency. It was 63 or something.
Yeah.
But the fact is that Bob Cook, because we had these mental retardation research centers, and in the Kennedy Institutes, the Shriver Center in Boston, the Kennedy Center in Baltimore, that each of these centers were multidisciplinary. Mm-hmm. And psychiatry was one of the disciplines.
Sure, yeah.
And so I was a psychiatrist at Hopkins, and Ludwig was a psychiatrist at Harvard. And the two of us would get together because we were both, we were at major institutions.
But I think the one in Boston was founded I think it celebrates its 50th anniversary this year, so 1967. So Ludwig was around that time, 66, 67.
Well, but see, the legislation, these didn't open the day after the legislation was passed. The Kennedy Institute in Baltimore was opened in 1968.
Right.
So they were contemporary.
Right, contemporary. So I have another question for you. Did you know of the work of John Fogerty,
No.
the congressman from Rhode Island?
No.
Yeah, who was very influential in the late 50s in establishing many of the legislation to support NIH, and also in his honor, the Fogerty International Center was named in 1967 after he died suddenly. So anyway.
No, everything I know, it really has to do with Bob Cook's involvement.
Right. So tell me, so having prefaced about, the Dr. Cook and also so tell me about how the Ludwig connection started then with you.
Well, it started when we would have meetings for these mental
centers.
retardation, the Kennedy Institute programs. We were colleagues.
And was the academy?
And we would work together with the academy.
Yeah.
Brian King was a resident at UCLA, and I tried to recruit him to Hopkins.
Yeah.
And Brian eventually joined us. But Ludwig and I would have, and Ludwig was really the leader in this, but we would have sessions at the academy meeting for people who were interested, and we had a committee on mental retardation.
Was Joe Piven also involved at that time? Or
no, Joe Piven came much later.
Much later, yeah. Well, Brian is one of the gentlemen of the field.
Right.
So the meetings were involved psychiatry as well, so that was kind of important to get to know one another. And
psychiatry was not a core discipline.
Yeah, right. It's one of the disciplines.
It was,
and not many programs had psychiatrists.
Right, but we did, and Ludwig did. But it was largely through the academy that Ludwig and I worked.
Yeah. So, what about George Tarjan? Did you have any connection with him?
Well, I knew George Tarjan.
Yeah.
And I always, in fact, in 1977, I met with George Tarjan at the World Psychiatry Conference in Honolulu, and we talked about the need to develop further services for these kids. This was just after I finished my training.
So these are all immigrants. Ludwig came from Poland and Israel, and George Tarjan came from Hungary, right? So at UCLA, there's an award named after him in developmental disabilities at American Academy of Child Psychiatry, which you are one of the
I couldn't
winners.
have come. I couldn't have come more from America because my ancestors came to Jamestown in 1611.
Right.
So.
Well, tell us about your ancestors. Now it comes out, all these privileged connections that you have.
But I wouldn't say they're privileged, but no, one of my ancestors, Sir Thomas Harris, sponsored one of the ships that went to Jamestown in 1611.
Wow.
And so we were the first Harrises on the continent, apparently. And my uncle always took pride in giving me this a little booklet, The Harris Family of Virginia from 1611 to 1914.
Do you know whereabouts from England your family came from?
Well, I think they came from Kent.
Kent?
But, yeah. But one of my ancestors in 1620 was the co-leader to put down the Indian revolt in Jamestown. So, all these nice family stories about these types of people. But since you mentioned, the only reason I mentioned this about them coming from Hungary and Poland is that I have to say that I came from the U.S.
Argentina, right? And Leo Connor came from Germany or Austria. I always get confused there.
He was born in Austria.
Austria, yeah. And Adolf Meyer came from Switzerland.
Yeah.
Right. So we are in good company. So your work on neurobiology, in addition to psychobiology, is very important, and understanding of neurobiology of social engagement, which is one of the areas that you've been interested in, and
that came from autism.
Yeah, it came from autism, and then you're publishing the textbook in 1996 that I wanted to go on the record as saying that selected as medical book of the year among 2,400 books published that year in 76 medical specialties, and so in 1996. So, and it was cited as covering both neuroscience and clinical issues in the New England Journal of Medicine, and for setting the agenda for an emerging medical specialty, which already had emerged, but they recognized it, which was thanks to you, thank you. And also a very important work that I was partially involved within the ICD-11, or I was involved with the ICD-11, but you work with leading the APA, American Psychiatric Association, DSM-5 group to adopt the intellectual developmental disorder conceptualization
Right.
of mental retardation, DSM-4R,
Right.
and then becomes intellectual development. Before it becomes intellectual disability alone, it becomes intellectual developmental disorder / Tell us a little bit about how you understand that in terms of, because people are listening to this and they want to know about what that change was in mental retardation.
Well, what happened was that I was on the committee, the neurodevelopmental committee for DSM-5.
Yeah.
And when I came onto the committee pretty much wanted to maintain what we had from DSM-4. But I had worked on death penalty cases, and I knew how the classification was being used to use an IQ number in the death penalty. And I wanted to make certain that we got away from a focus on IQ number and we began to focus on intelligence. So I convinced the rest of the committee that since we were moving away from a multi-axial classification, that we had to make intellectual disability intellectual developmental disorder, which was a real axis 1 diagnosis in a sense. It was now, for the first time, moving from essentially a risk factor for prognosis into a category of its own. And the rationale for doing that was clearly made by the WHO ICD group when they showed that neurodevelopment and neurodegeneration both could be included. You could have Alzheimer's disease of dementia at one end of the spectrum and neurodevelopmental disorders at the other. So I looked for a definition that both the AAIDD and the APA could agree to, which was a consensus definition from 50 psychologists. And we used that definition of intelligence, and for the first time, we incorporated a definition of intelligence into the diagnosis. Mm-hmm. And necessarily by doing that, we were focusing not only on IQ testing, but neurocognitive testing. So we were moving away from IQ focus to adaptive reasoning focus. And so the focus on adaptive reasoning was really a paradigm shift. And in doing that, I basically, having talked, we were focusing, harmonizing with ICD-11, and our goal was to use the same type of language. And so we were actually in agreement on intellectual developmental disorder for DSM-5, but then we had to go through other levels of approval. And since intellectual disability was used so broadly in the literature, the APA decided that they would use that term and we'd put intellectual developmental disorder in parentheses, anticipating ICD-11.
Of course, this was in the proposal, and credit to be given where credit is due also, right, which is Luis Salvador Carula and right, Marco Bertelli, and the group that included a number of people, including myself. We met in Sicily, and this whole concept of intellectual developmental disorder was discussed. So the ICD-11 group, to which you were the APA liaison, which was a very innovative step, because this idea and I think Steve Hyman actually deserves credit in that as well, in terms of trying to coordinate the ICD work with the APA DSM-5 work. And at the beginning, I think Michael Rutter was involved with that as well. Yeah. So it was a very profoundly important step. And
I just had to make sure that we understand. I completely credit the ICD paper they published on the concept of intellectual developmental disorder, because in world psychiatry, because if they had not published that paper, I couldn't have made the argument that I did. And as it was, we made certain that it was understood in DSM-5 that this was not a disability, but it was a disorder. Yeah. And by making disorder criterion and having those criterion focused on problems in reasoning, problem solving, and so on.
Well, thank you, Jim, for explaining that. But also, what I always found incredible about you is this sense of integrity. Well, it's I mean, it's which is so maybe it's just very intrinsic in you, in the way you do your work, because you always try to make sure that whatever is done appropriately. It's not spinned, but also your beloved, wife's contributions. Professor De Angelis' work in the conflict of interest, the head of JAMA, and you can tell us about that. Kathy's amazing contributions to integrity in science, integrity in publishing, integrity of training people, and doing these things. So I always admire that about you. So don't be shocked. Okay. So you also had a lot of, and we're not going to take too much more time, but you've had a lot of contributions to participating in journals and editorial boards, and I know one of them is JAMA Psychiatry, or what used to be called the Archives of General Psychiatry. But also during the tenure of Joe Coyle as the editor, you contributed some art in the history of medicine, history of psychiatry, which maybe you can tell us a little bit about that. These are actually available for free on the JAMA website, and people can look at them. There are about 140 plus images with essays.
Well, just briefly, this goes back to psychobiology.
Yeah.
Because when Joe Coyle became the editor of the journal, he was appointed by Kathy De Angelis as the editor. When Joe became the editor, it was decided that the journals, the archives journals, could have art on the cover, as JAMA did, but would have reference to papers in the journal. So what Joe and I decided was this: most of our content in the journal was going to be focused on neuroimaging, neurogenetics, epidemiology, to some extent psychotherapy, but the biology was very prominent in the journal. So we wanted to make certain that we remembered what Adolf Meyer always taught, and George Engel learned from him, that the central focus in psychiatry, as Leo Kanner said as well, is on the individual person. And so each cover of the journal was to be a Meyerian portal to that issue. And so we started with a person in the personage of an artist or a psychiatric theme, and used that case study, in a sense, to remind everyone that psychiatry has to do with people and their suffering, and the things we're writing about in this journal influence their mental illness, either environmentally or biologically. But it was to be looked at is to be an integrated focus on integrating the person in psychiatry into each issue. And that's the way we did it.
Yeah, I mean, I think these are amazing 12 years, from 2002 till 2014. And these were issues, 145 commentaries, using a psychiatric theme from the life of an artist or subject of his art or her art, linked clinical and neurobiological issues. So finally, I want to get back to Leon Eisenberg. And this is sort of now, I think 6 years after you're the recipient of the Leon Eisenberg Award in 2011, and you have come to every session, for which I thank you. You had an amazing contribution to making sure that we also honored Ludwig Szymanski at Children's Hospital. So, and I wanted to ask you about how did you get to know and get more close? I know that you knew about him because of Leo Kanner and his writings, and of course to know Leon is to read about what he writes all the time. He was very prolific. But tell me about how you interacted with him and your meetings with him.
Well, actually, Kathy played a major role
Oh,
in
yes,
this.
that's right.
Because
Now
Leon
it
and
comes up.
Kathy were both worked with the Robert Wood Johnson Foundation. And so they were constantly
Yes.
getting together, telling jokes, and so on. And Leon would come back for the Hopkins biennials, and I would meet with him and talk to him then. And then I began a correspondence with him. But it was his writing that particularly influenced me.
Yes.
His essay on development as a unifying force in psychiatry,
Absolutely.
his essay on mindfulness and brainfulness,
Right.
but particularly his social conscience, because he amplified what Leo Kanner began as far as I was concerned. I mean, I remember once that he came to the Hopkins Biennial and he put aside his scientific talk and talked to us about the problems of the Greek junta and what was going on and how we needed to be involved as psychiatrists in the events of the day and not move ourselves away from social consciousness. And I was very impressed when Leon became the chair of social medicine at Harvard.
Right. So I think that what Leo and I always say added was that he added the developmental psychobiology, sort of almost like he added the word development to psychobiology.
Right.
And to also to really, and already psychobiology was enriched with a lot of intellectual and cross-cultural aspects. And because I know that Meyer used to have breakfast meetings in his room where people will talk about what was in the social affairs and politics of the day and write letters to the editor and this kind of thing, which made them not very popular in the United States, from what I understand. But I think what Leon did was to bring that developmental concept, which I believe also that you, Jim, have taken into really a very important developmental perspective in developmental neuropsychiatry under your writings, and especially in the book that you edited, and not edited, actually you wrote yourself, the 2-volume 1996 book, which essentially makes a very important case for that and puts in a very elegant academic setting. And I encourage people to read the book.
Well, actually, I'm writing the second edition.
Yes.
We're having the 20th anniversary edition.
Right.
But there's one other thing before we stop, Kerim. I think it's important that people know that we need to continue in the Academy of Child Psychiatry to emphasize the needs of children with neurodevelopmental disabilities. We have a committee, but we don't have enough presence within the meetings. And so last year, Kathy and I made a donation to the Academy to establish the Developmental Neuropsychiatry Forum.
Yep.
So each year we will choose a disorder to study. And this year's speakers are Sir Michael Rudder and Charles Nelson, who were recipients of the Leon Eisenberg Award. But I think it's important that people remember that development is key not only in psychology, but also in neurobiology and in long-term developmental trajectory.
Well, yeah, I'm particularly happy because Sir Michael Rudder is coming to the Academy again this year in October. And the History and Archives Committee, actually, for which we also do these interviews, had sponsored the trip, and he's going to spend a day at Cornell University, Cornell Medical School in New York to give a talk as well as participate in the Harris Forum. And this is a very important edition, the Harris Forum, Neurodevelopmental Forum, under your leadership and your support, and under Brian King and Jeremy's leadership now in the Committee of the Autism and Intellectual Disability, which is now sponsoring the event on Thursday this year in October 26th. So, but I want to end last because I want to congratulate you I would be the first person formally to congratulate you in this interview on winning the Catcher of the Rye Award in 2017 in the American Academy. This is one of the most prestigious awards. It's given to both recognizing humanitarian contributions to the welfare of children, either among academic people and as well as people who are involved in philanthropy. So, and I know that this award goes for the second time to your family, Kathy DeAngelis being also a winner of this Catcher in the Rye Award. And you sent me an email. I'm going to read this, Jim. In the book, Holden Caulfield has slipped in to visit his sister Phoebe in the middle of the night. He is very depressed, and she asks him if he cares about anything at all. And Holden responds by asking if she knows what he would really like to be if he really had a choice. So the ACAP emphasizes this response in the award, and Holden says, I keep picturing all these little kids playing some game in this big field of rye and all, thousands of little kids and nobody around, nobody big, I mean, except me. And I'm standing on the edge of some crazy cliff. What I have to do, I have to catch everybody if they start over the cliff. So this is the J.D. Salinger Catcher in the Rye quote that is important for the Academy for this award. Congratulations. So we are very happy to talk to you today. And if you have any other comments to make, we'll end. And I want to thank Carola for hosting us in her wonderful home in Cambridge, and Beverly Gilligan, who's organized this for us.
Well, I think that had the award been created soon enough, the person who would clearly have received it with great applause would be Leon Eisenberg.
Yes.
Because he helped many people from falling off the cliff and having a normal life.
He certainly helped me from falling off the cliff.
He didn't save me from falling off the cliff, but he had me staying in the cliff.
I think Leon would have fallen off the cliff had it not been for Carola.
I think he would have.
Thank you very much. All right.
Thank you. That was like a reviewing of history for me. It was extraordinary, really.